Welcome to the third part of this series where I'll be talking about the second priority or the second ask that the World Heart Federation, in collaboration with global health experts on cardiovascular health and cardiovascular diseases, are proposing to the United Nations high-level meeting in 2025. My name is Ogweno Stephen. Let's roll. The second commitment that the World Heart Federation is asking of the United Nations high-level meeting 2025 is the adoption of national cardiovascular health plans. Why are national cardiovascular health plans so important, and why do they form part of the four key asks of the global experts on cardiovascular health as a part of the strategies to be adopted to increase the control and prevention of cardiovascular diseases? National health plans form a critical part of the control of cardiovascular diseases. Interventions like tobacco control and alcohol control and a focus on ensuring that there is access to primary preventive measures on cardiovascular health across the citizenry, including health screening, have been part of the interventions that have been adopted in previous national plans that have led to a rapid improvement in cardiovascular awareness and a reduction in deaths and mortalities on cardiovascular diseases. This adoption of such policies is what the World Heart Federation is asking of governments to recommit and to develop comprehensive and well-funded cardiovascular health plans across each and every nation to ensure that cardiovascular diseases have a focus, a priority, and that they are well-funded to ensure that interventions can be able to be implemented. Again, the focus this time around is really on implementation, and there is a broad feeling and understanding backed by evidence to show that when you invest in cardiovascular health, when you invest in developing national health plans, that you're able to improve the wellness of nations, you're able to improve the wellness of the community, and you're able to reduce the deaths that are caused as a result of non-communicable diseases, and in this case, cardiovascular diseases. This is the second priority area that the World Heart Federation is requesting and is presenting at the United Nations high-level meeting with a goal to really see that, again, we are reducing the deaths, the suffering, the high out-of-pocket costs, and the unnecessary expenditure as a result of cardiovascular diseases, and that on the flip side, we're able to see a rise in health, in wellness, and a rise in the adoption of cardiovascular health interventions to improve health across populations. And with that, thank you very much, and see you on the next episode where we'll be talking about the third priority that the World Heart Federation, in collaboration with global health experts on cardiovascular health and wellness, are suggesting and proposing to the United Nations high-level meeting as part of the broader strategy to reduce the deaths and suffering from cardiovascular health and to improve wellness in the communities. Thank you, and see you on the next one.